hospital legally turn you away from the ER if you don't have insurance? The answer might surprise you, and the law behind it is something that every patient in the United States should know. Hi, my name is Aaron. I'm a licensed clinical social worker, and this is the start of a new series called Know Your Healthcare Rights, where I break down the law, policies, and loopholes in healthcare system that every patient should understand. Today we're talking about EMTALA, one of the most important patient protection laws in the United States. Well, EMTALA stands for the Emergency Medical Treatment and Labor Act. It was passed in 1986 after hospitals were caught doing something called patient dumping. Basically, that's refusing care to people who don't have insurance. Now, under EMTALA, if you show up at an emergency department at a hospital that accepts Medicare, which is nearly every hospital in the country, they're legally required to do three things. First, they must give you medical screening exam to determine if you have an emergency medical situation. Second, if you do have an emergency, they must also stabilize you. And then three, if they cannot stabilize you there, they must arrange a safe transfer to a hospital that can. Why does this matter? Well, this means hospitals cannot legally refuse to evaluate you in the ER simply because you don't have insurance or money. Now, there are limitations, but here's the part that people misunderstand. EMTALA is not health insurance. It doesn't guarantee treatment for non-emergencies. It does not require hospitals to provide long-term care, and it definitely does not mean the visit will be free. You can still receive a bill for that care. So EMTALA protects your rights to emergency evaluation and stabilization, but it doesn't solve the bigger issue of how healthcare is paid for. If you want to understand the healthcare system and your rights inside it, follow along because in this series, we're going to break down the rules that most patients never get told.